Hello, everyone. Thank you for joining today's Lunch and Learn. Today, we're going to be talking about GLP medication through a nutrition lens. As many of you know, GLP-1s have become a very common part of care for weight management and metabolic health. The evidence is strong. We see clear improvements in blood sugar, body weight, and overall cardiometabolic risk. But when we step back and we look at research, and also we look at clinical practice, we also recognize something important. We see the GLP medications can create nutrition gaps if food is not intentionally supported. So today we're going to take a closer look at GLP therapy, specifically through a nutrition-focused perspective. But before we begin, let me tell you a little bit about myself. So my name is Emina. I am an integrative and functional registered dietitian with nearly 15 years of experience. I take a whole person evidence-based approach to nutrition with focus on cardiovascular health, blood sugar balance, hormonal health, and bone health. I genuinely love this work. Nutrition is my jam, and I'm very passionate about helping people build sustainable yet realistic habits while still developing a healthy relationship with food and their bodies. Supporting clients in GLP-1 therapy is something I have become deeply passionate about, and I'm really excited to be here and share this topic with you all today. But I also want to share how unbelievably grateful I am to be surrounded by an incredible team of fellow providers. So if I ever have a question or don't have an answer for something, I have amazing colleagues I can collaborate with to make sure my patients get thoughtful care and well-rounded care. So presentation objectives. I'm going to just shut this off because it's distracting me. Okay, so presentation objectives. Before we dive in, I want to be very clear about the goals of today's talk. So this is today we're not going to debate whether GLP medications are good or bad. Today we're going to focus on understanding how these medications work, where nutrition-related challenges can arise, and what kind of support helps protect long-term health. I'll be sharing what the research shows along with the patterns I'm seeing in clinical practice. And my hope by the end of this presentation that you feel more confident in 4 key areas. Understand how GLP medication work on a very simple level and where nutrition gaps can develop. Recognize the most common nutrition-related risks associated with GLP-1 use. Identify practical strategies to support safety in long-term health. And finally, understand the critical role of registered dietitians and certified nutrition professionals in optimizing outcomes while using GLP-1 therapy. Hi, why are GLP-1s everywhere? So GLP medication may feel like they appeared overnight, but the reality is they have been building for years. Ozempic was first approved in 2017 for type 2 diabetes, so it's been almost 10 years. And since then, we have seen expanded use, more potent medications, and many additional GLP-based therapies currently in development. In fact, more than a dozen of new GLP medications are expected to reach the market by 2030. We also, over the past few years, use has accelerated rapidly. And I have seen this in my own practice. I have seen this shift in my own practice. Like if I think about 2025, maybe I had a couple of clients using GLP medication. Today, that number is significantly higher, and that change has happened pretty fast. If you look at data and patterns in the United States, there are reports about 6% of U.S. adults are currently using GLP medication, and roughly 12% are reported current use or past use. Now you may be wondering, why is she telling us this? Why do we care? Well, the reason why this matters is because while prescribing has moved very quickly, the system to support nutrition, muscle, bone, and long-term health have not kept pace. And so the gap between medication use and comprehensive support is exactly what we're here to bring awareness to. Next slide. Okay. So how do GLP medications work? So this is in a very simple explanation, simple diagram. So GLP medication work by several systems in the body, including the brain. So they strengthen fullness signal in the brain, or fullness signal in the brain. They also slow how quickly food leaves the stomach, and they also improve how body handles blood sugar. So in large, these effects lead to real improvements in blood sugar, so lower fasting levels, better after meal control, and also lower A1C. These benefits show up not only in people with diabetes, but also in those with insulin resistance and higher metabolic risk. We also see a significant weight loss, about 15% of body weight with semaglutides and 20% or more with tirzepatide. So that is more than most people ever achieve and sustain with diet alone. So, kind of put this in context, like if you look at diet and exercise, we look at research and studies. So people maybe can achieve 7 to 10% of weight loss, but which is very hard to sustain. And these medications are resulting in double those percentages. But also, this is a reminder that people are eating a lot less, which is why nutrition becomes such a big part of making this safe and sustainable. So when we look at beyond weight and blood sugar, GLP-1s improve heart-related markers like blood pressure, cholesterol, inflammation, and some studies even show fewer heart attacks and strokes in high-risk individuals. So this is not a hype. GLP-1s work for most people. The real question is how we support people so these benefits are protected and sustained over time. And now I think, to understand that it's going to help us to think about what GLP medications don't do. So we have already discussed they reduce appetite, overall intake, which results in, weight management and cardiometabolic risks. But what GLP medication don't do, they don't guide food quality or eating patterns. They don't protect muscle mass. They also don't protect bone health. They don't support gut health, and they don't build sustainable eating or moving habits. So, for example, if someone starts a GLP medication but does not receive support around nutrition and movement and behavioral changes, they may still be a risk for nutrition deficiency and other health concerns. Eating less on its own does not always mean better health. So yes, GLP-1s are powerful tools, but they are incomplete without comprehensive nutrition care. I'm gonna take a sip of water. I was talking all morning long, so my mouth is dry. Okay, so in practice, this is where we often see the disconnect between weight loss and health. So this slide shows the overall pattern we commonly see. So for many people, it starts with reduced appetite and GI symptoms when they start, GLP-1 therapy. So things like nausea, early fullness, reflux, constipation. So as eating becomes more comfortable, irregular, overall intake drops. From there, we see low energy and protein intake, followed by reduced fiber, micronutrients, and food variety. So over time, that can lead to downstream effects like fatigue, low energy availability, changes in gut microbiome, loss of muscle and bone mass, vitamin and mineral deficiency, but also reduced physical activity. I'll go through each of these in the next few slides, but the main point is that these aren't like random side effects. They're predictable outcomes when these issues aren't addressed and when nutrition is not planned intentionally. Okay, so appetite suppression and skipped meals. This is an important slide because GLP medications are designed to reduce craving, enhance satiety, kind of calm down the food chatter, but they're not designed to eliminate hunger altogether. However, for many of my clients, and they don't initially recognize overly suppressed appetite as a problem. And, sometimes I think it's largely because diet culture has long framed the absence of hunger as success. So when normal appetite signals are excessively blunted, it can unintentionally lead to patterns such as skipped meals without realizing it, feeling full after only a few bites, not feeling hungry at usual meal times, and forgetting to eat altogether. So over time, irregular eating can contribute to low energy, fatigue, brain fog, dizziness, less stable blood sugar levels, difficulty meeting protein needs, fiber and micronutrients. And so what's really important to kind of understand from this slide, reduced appetite does not reduce body's need for nourishment. Also, I also want to just kind of mention that persistent or complete appetite suppression is a signal, to reassess medication dose, timing, and overall nutrition support. So if I have a client and that I'm working with and I'm noticing, the appetite is suppressed and that is a time that I would coordinate care with their prescribing provider and try to address that before it leads to nutrient deficiency, muscle, bone loss, and also negative side effects impacting their long-term health in a negative way. Okay, next slide. GI symptoms in GLP-1 therapy. So digestive symptoms are very common with GLP medication. So nausea, bloating, reflux, because the patient often appear early. For some individuals, these symptoms improve over time. For others, they persist or even get worse. I particularly see this when overall food intake is low, fiber and fluid intake are inconsistent, or pre-existing GI issues were not starting the medication. So it's really important to understand that GLP medication intentionally slows gastric emptying, just like I explained in there. That's the part of mechanism of action. However, when somebody already struggles with GI conditions such as chronic constipation, reflux, irregular bowel movements, this slowing can amplify existing symptoms. And so this is why timing and preparation matter. So addressing GI health before initiating GLP therapy, especially because the patient can significantly improve medication tolerance. Because without this foundation, we often end up layering medication on top of an unresolved issue, making symptoms harder to manage. But the good news is that GI side effects are preventable and managed with appropriate nutrition support, which includes addressing GI health before starting GLP medication if indicated, and making sure that there's adequate hydration, consistent fiber intake, regular meals, and sometimes usage of prokinetic support, probiotics and prebiotics can make a meaningful difference. Because supporting gut health early on not only improves comfort, but may also reduce discontinuation rate as GI side effects remain one of the most common reasons people stop GLP-1 therapy. Low protein intake and muscle health. I do think a lot of my clients starting GLP therapy do have some awareness of muscle mass loss. So, but yeah, appetite does not mean decreased protein needs. So on GLP therapy, so when somebody is on GLP therapy, appetite is suppressed, which often leads to smaller and skipped meals and snacks. It's there. Are you okay? Without intentional planning, protein is usually the first nutrient to fall, along with fiber and key nutrients. This is partially because when GI tract fills off, protein is often the least appealing option. So if you think about, the time when you're sick, when your stomach is not feeling well, most people crave crackers, toast, so simple carbs, not chicken, eggs, or meat. So GLP-1s can create this similar internal environment, making it hard to meet protein needs unless it's intentionally supported. But when dietary protein is sufficient, our bodies are so smart. So they pull amino acids from its own tissue and mainly skeletal muscle. And this is why we see 25 to 40% of weight loss on GLP-1s can come from lean mass and not just fat. And so why do we care? Well, we care because skeletal muscle is critical. It is a metabolic organ that supports our metabolic health. It supports strength and physical function, and it also supports long-term weight maintenance. Muscle is very difficult to rebuild once it's lost. So, when we're in GLP, when we're utilizing GLP-1 therapy, the goal should never be just weight loss. It should be protecting health while losing weight and prioritizing adequate protein intake and strength training early in GLP-1 therapy is essential to preserve lean mass and long-term health and outcomes. In my practice, I actually I really advocate and I work with providers and clients to start establishing consistent strength training program before starting GLP-1, because what I often see, that once treatment begins, because of low energy, appetite suppression, life demands, it makes it so much harder to establish these new habits, even with good intentions. Next, we talk about bone. One of my favorite topics. Bone is definitely overlooked on during GLP-1 related weight loss. But when people lose weight quickly, bone experiences less mechanical load, and that weakens the signal needed to maintain bone health. At the same time, appetite suppression commonly leads to lower intake of protein, calcium, vitamin D3. These are all key nutrients that we need to preserve bone health. Preserving bone mass, matters even more for people or women in midlife, especially those that are going through perimenopause and menopause, or also the ones that have long history of dieting and also now strength training. In these cases, weight loss may look successful on the outside, but bone density can quietly decline, increasing fracture risk. So GLP medications do not protect bones. So if we don't intentionally support nutrition and resistance training and impact-based training, bone loss can occur alongside weight loss. And this is preventable. So adequate protein, sufficient calcium, vitamin D, and consistent strength training can help us preserve bone while still benefiting from GLP-1 therapy. Low fiber and micronutrient risk. So one of the most significant concerns with GLP therapy is undernutrition. And honestly, this is like one of my biggest concerns. We're now seeing weight loss of 50% or more at pace that would typically raise red flags for malnutrition in most clinical settings. So when I worked in a hospital as a clinical dietitian, if I had a patient that lost 50% of their body weight, we would diagnose that, that person would most likely be diagnosed with malnutrition. However, in the context of GLP-1, it's often treated as expected, and micronutrient screening is really a routine. As mentioned in previous slides, intake drops for main three reasons: reduced appetite, early satiety, smaller portions. And so over time, food variety also narrows, which further increases the risk of nutrient gaps. Fiber intake almost always decreases unless it's intentionally supported. And this matters beyond digestion. So we all know that we need fiber to have regular bowel movements. The low fiber intake impacts our gut microbiome diversity, which directly impacts blood sugar regulation, cholesterol metabolism, inflammatory pathways, and potentially undermining long-term cardiometabolic health. At the same time, reduced intake increases risk for micronutrient deficiency, particularly iron, zinc, magnesium, calcium, and fat-soluble vitamins. Some of the early signs are fatigue, muscle weakness, hair loss, or wound healing. And these are often attributed to medication itself when they may reflect inadequate nourishment, inadequate nutrients. So the risk is even greater in individuals who begin GLP-1 therapy with pre-existing deficiencies from years of restricted dieting or highly processed food. And for this reason, targeted nutrition support is critical. I actually recommend baseline micronutrient testing prior initiating GLP-1 therapy with repeated testing 3 to 6 months, or sooner if weight loss exceeds 10% within 3 months. The role of dietitians and nutrition professionals in GLP-1 care. I will say this is my favorite slide. As GLP-1 use continues to expand, and as I explained, these medications are not going anywhere, it's becoming clear that medication alone is not enough. And it really makes me happy to see that in 2025, so last year, I think in June or July, a joint advisor from leading professional organizations highlighted that while GLP-1s can produce meaningful weight loss, long-term success is often limited by common challenges: GI side effects, nutrition insufficiencies, muscle and bone loss, and higher discontinuation rates and weight regain. And this is where registered dietitians play a critical role. Dietitians are uniquely positioned to provide comprehensive nutrition, behavioral, and lifestyle support before, during, and after GLP-1 therapy. So that includes supporting adequate protein micronutrients intake, preserving muscle and bone through nutrition and education around resistance training, helping manage side effects, but also addressing GI issues before starting GLP medication, and also supporting sustainable behavioral changes around eating patterns, physical activity, sleep, and stress. Dietitians also play an important role in screening for eating disorders, substance abuse, and mental health concerns, all which can directly impact treatment outcomes. So the key takeaway is GLP-1s can change appetite, but they don't ensure nutritional adequacy or healthy behavioral change. And this is, this is just what we discussed, the graph that kind of explains, their nutrition priorities to supporting GLP-1 therapy for obesity, and how dietitian can play a role in optimizing care and making sure that long-term health is not compromised. Okay, so the key takeaway from today's presentation, and we'll have plenty of time for questions. GLP medications are powerful tools, but they're not complete care. They reduce appetite, but they don't reduce nutritional requirements. And without proper guidance, they risk becoming another weight loss strategy that unintentionally compromises long-term health. And let me repeat that again. Without proper guidance, they risk becoming just another weight loss strategy that unintentionally compromises long-term health. Anyone considering GLP-1 therapy should work with a registered dietitian before starting treatment to assess nutritional status and continue to receive support through therapy. This is how we protect muscle mass. This is how we protect bone health. And this is how we protect metabolic health and long-term health. GLP-1s are most effective tools that we have so far, but only when combined with intentional nutrition, behavioral changes, resistant training, individualized care. Weight loss should never come at the expense of long-term health. Okay, so our next Lunch and Learn will be on March 12th, led by our lovely Chelsea. She will be talking about healthy meal planning for busy families. So please tune in. Mark your calendars for March 12th. And I also want to share that our insurance that we're networking and states that we proudly serve. And lastly, I think we're open for questions.